Question 1. A client is admitted with suspected peptic ulcer disease. Which of the following findings would most likely indicate perforation of the ulcer? A. Hematemesis. B. Melena. C. Sudden, severe abdominal pain. D. Nausea and vomiting. Answer C. Sudden, severe abdominal pain. Rationale. Sudden, severe abdominal pain is a hallmark sign of a perforated ulcer, as the contents of the stomach or duodenum spill into the peritoneal cavity, causing intense pain. Hematemesis, vomiting blood, and melena, black, tarry stools, are indicative of bleeding ulcers, but not necessarily perforation. Nausea and vomiting can be associated with many GI conditions and are not specific to perforation. Question 2. A nurse is providing discharge teaching to a client with a new colostomy. Which statement indicates the client needs further teaching? A. I will change the colostomy bag every 3, 5 days or as needed. B. I can eat whatever I want without worrying about how it will affect my colostomy. C. I should empty the colostomy bag when it is 1/3 to 1/2 full. D. I will notify my healthcare provider if there is any unusual odor or change in the stomach color. Answer B. I can eat whatever I want without worrying about how it will affect my colostomy. Rationale. Clients with a colostomy should be mindful of their diet. Certain foods can cause blockages, gas, or odor. The other statements indicate correct understanding about colostomy care. Question 3. Which of the following would be the priority intervention for a client with acute pancreatitis? A. Administering antibiotics. Providing a high-protein diet. C. Keeping the client, NPO, nothing by mouth. D. Encouraging early ambulation. Answer C. Keeping the client, NPO, nothing by mouth. Rationale. Keeping the client, NPO, is crucial in acute pancreatitis to rest the pancreas and reduce pancreatic enzyme secretion. Antibiotics may be used if there is an infection, but it is not the first priority. A high-protein diet is not appropriate during the acute phase. Ambulation is important for general recovery, but not the immediate priority. Question 4. A client with cirrhosis of the liver is at risk for hepatic encephalopathy. Which dietary modification should the nurse recommend to the client?
A. High-protein diet. Low-protein diet. C. High-fat diet. D. Low-carbohydrate diet. Answer B. Low-protein diet. Rationale. A low-protein diet is recommended to prevent the buildup of ammonia, which can exacerbate hepatic encephalopathy. High-protein diets are generally avoided in clients with liver disease for this reason. High-fat and low-carbohydrate diets are not specifically indicated for managing hepatic encephalopathy. Question 5. Which of the following is a common symptom of gastroesophageal reflux disease? GERD. A. Right upper quadrant pain. B. Heartburn. C. Hematochezia. D. Jaundice. Answer B. Heartburn. Rationale. Heartburn is the most common symptom of GERD, characterized by a burning sensation in the chest due to stomach acid refluxing into the esophagus. Right upper quadrant pain could indicate gallbladder issues. Hematochezia, bright red blood in stool, and jaundice are not typical symptoms of GERD. Question 6. A nurse is assessing a client with suspected appendicitis. Which finding would most likely indicate a ruptured appendix? A. Fever. B. Rebound tenderness. C. Sudden relief of pain followed by increased pain. D. Loss of appetite. Answer C. Sudden relief of pain followed by increased pain. Rationale. Sudden relief of pain followed by increased pain suggests that the appendix has ruptured, leading to peritonitis. Fever, rebound tenderness, and loss of appetite are common symptoms of appendicitis, but do not specifically indicate rupture. Question 7. A client with Crohn's disease is experiencing an exacerbation. Which of the following interventions should the nurse prioritize? A. Encouraging a high-fiber diet. B. Administering antidiarrheal medications. C. Promoting bowel rest. D. Providing lactose-rich foods. Answer C. Promoting bowel rest. Rationale. During an exacerbation of Crohn's disease, bowel rest is essential to reduce inflammation and allow the intestines to heal. A high-fiber diet can irritate the bowel.
Antidiarrheal medications may be used but are not the priority intervention. Lactose-rich foods should be avoided if the client is lactose intolerant, which is common in Crohn's disease.